I don't just think we're bad at using technology. I think we're very bad at using technology. So I think overall we're not good. I mean, it's you know, for us to, that there are many practices who still haven't managed to embrace online consultations, which is, you know, quite, if we take ourselves out of health, we think actually most people do communicate on email these days, you know, it is, but actually somehow for some practices, online consultations are still very difficult. Texting patients is still very difficult. So I think our baseline is very low. The other thing to say in probably our defense is we are not very approach. So I've been recommending a few like sleep apps to my patients, but that's actually because I was approached by some people who were involved in that app. I wouldn't have known about it otherwise. It didn't happen through the practice or the PCN. One of the reasons I was very interested in this is because as a GP, I'm very limited and very rubbish at treating insomnia. You know, all the medications are addictive. We don't want to give sleeping tablets, and actually not everybody is clinically depressed, but there's a lot of distress with cost of living and isolation, COVID trauma. A lot of people are suffering from mental distress at the moment, which isn't clinical depression. So insomnia is big. So that was really helpful in my work, but I wouldn't have known about it unless it was you know, it was like a chance meeting like you and me. So I guess a question for myself is, how do we talk to suppliers and, you know, industry more, and how do we do that without I guess, how do we do that? This is probably not so much for the younger GPs because they've been probably brought up differently, but certainly 22 years ago when I trained, Phil, like, you didn't talk to anybody in pharma because somehow you would get, you know, it was a bad thing to do and they'd give you too many pens and you weren't allowed to have the pens. There was a real sort of almost a moral thing about it. You don't have, like, we never had drug reps in our practice. And as time has gone on, I mean, I recently did a health inequalities webinar with I can't remember who, but one of the big pharma, I can't remember the Pfizer, I can't remember who it was, but it was nothing to do with brand. It was just that they wanted my you know, we did a webinar with some other experts on health inequalities, but there was no branding in it at all. And I thought this is such a great thing because we're giving information. So I think there's a cultural thing to overcome for both sort of he's my age and pharma, and then the whole practical of actually how PCNs are probably better placed, but how do you go to, you know, even 46 practices in one small area, but PCNs are big units, so it might be easier to approach PCN.